Thanks for the introduction. Hi everyone, my name is Peipei Zhao. I'm from School of Public Health at Nanjing Medical University. It's my pleasure to be here and share with you our team's research on sexual orientation and gender identity change effort. Also, we can call it SOGICE. So, and also the association between SOGICE and the mental health outcomes among people living with HIV in Chengdu, China. So a little bit about the background. So sexual orientation and the gender identity change effort, SOGICE, is also called as conversion therapy or conversion practice or repertory therapy. So it refers to the practices that deny, suppress, and change gender identity or sexual orientation or gender expression among sexual and gender minorities. So this practice has been acknowledged as a pseudoscientific, unethical, and harmful practice, but although it's still very prevalent across the world. And it happens, this practice takes place in the context of cis normativity. So where social cultures believe that cisgender and heterosexual relationships are the normal or the right way. So these actions are kind of a violence suppression towards gender and minority population. So in China, according to a report by Beijing LGBTQ Center, nearly 12% of the transgenders have reported being coerced into conversion therapy by their family members. And previous studies have reviewed that people exposure to SOGICE may be at a higher risk of mental health disorder. And here, they are studying mostly focus on the LGBTQ population generally, but here we want to focus more on the special subgroup people under LGBTQ people who are like people living with HIV and AIDS. We all know that from previous presenters, they show that people living with HIV and AIDS, they have higher risk of mental health problems. And if those who are, if they are also exposed to like conversion therapy or SOGICE, and they might experience more psychological burden. So, as I said, most studies focus on LGBTQ population in general, so the specific or the unique experience of people living with HIV and AIDS, they are remaining under-investigated. And also, for the study of SOGICE, and the limited study has been conducted in low and middle income country and including China. So this study aimed to understand more about the SOGICE experience among people living with HIV, and also to explore how the SOGICE associated with the mental health outcomes. So this study is part of the Treasure cohort study. Treasure stands for Transformative Research for Equity and Social Determinants, Uplifting Resilience and Empowerment in LGBTQ plus Health. So this is a cohort study conducted in Chengdu, China. So we recruited participants who are 18 years old and above, and also self-identified as LGBTQ plus population, and they live in the Chengdu city, or their main activity happens in Chengdu city. And till February 2025, we have included nearly 8,000 LGBTQ participants, and we also identify 642 people living with HIV, accounts for 8% of this cohort. And also this cohort is joint initiated by Southwest Hospital at Sichuan University and the NICE team at Nanjing Medical University, and also Tongzhi Health Counseling Center, which is a CBO serving LGBTQ population. And here are the main exposure and outcome variables I used in this study, and also I present how they are measurement. So some of the variables are measured by customized question. For example, so the SOGICE we ask, we provide a list of conversion practices, and we ask what types of conversion therapy have you undergone in order to change your sexual orientation or gender identity. So, and also about the non-suicidal self-injury, we also have this like a customized question, like do you ever do something to hurt yourself on purpose without suicidal intent? So, and for depressive symptoms, suicidal ideation or attempts, and PTSD symptoms, we measure these outcome variables in a standard scale. And for the association, we use multiple logistic regression to explore the associations. And here are some results. So the table 1 here presents the demographic information of the population. We can see that the average age of this sample is 35.5 years old, and the majority, like over 97% of them are male, and also more than 60% of them are cisgender. For the sexual orientation, nearly 80% of them are gay, and also 50% are bisexual. So based on the demographic information, we can see that this sample majorly composed by gay men who have sex with men. So I want you to pay attention to this because of the population components, we can not really generate the findings to all the population, all the people with living with HIV. And also there are some information about their education level. So over like 60% of them have a bachelor degree or above, and also nearly 2/3 of them have full-time employment, and the majority of them are Han ethnicity, and nearly more than half of them are single, but also nearly half of them have a romantic partner or a sexual partner. And for the general health, like nearly 40 of them rated their health as not good. And here is the prevalence of the SOGICE of this population. We can see slightly over 10% of them reported experience SOGICE in their lifetime. And at the right of the slides, I list all the forms of SOGICE that they experienced, and these 5 practices are on the top, like psychotherapy, verbal insult, forced change in appearance or dressing style, and force into marriage and confinement. And also there are some relatively violent measures like beatings, and also like electroshock therapy, and even our surgery. So these are the forms reported from the population, and also we can see that more than half here of them experienced more than one forms of SOGICE. And then we ask more like the details of their SOGICE experience. Here are some characteristics. For example, we ask them if they participated or engaged in the SOGICE voluntarily or forced into that. We can see that nearly half of them reported forced into the SOGICE, and also we also have 15% of them reported voluntarily engaged in SOGICE, and also more than 38 of them reported both forced participation and also voluntary participation. And as for the first SOGICE experience, and nearly 37% of them reported experience it before 18 in their childhood. And also for the scare level, we have 3 levels, so which is low or relatively not very scary, or moderate scary, or very scary. Well, very scary. We can see that more than half of them reported is kind of scary, and also for the duration, nearly half of them reported have experienced this less than 3 months. But we can also see that like 10%, nearly 10% of them experience the SOGICE more than a year. And for the location of the SOGICE experience, nearly more than half of them reported that happened in their family, and also 37 reported having it happened in the psychological counseling institution. And also another 1/3 reported that they have experienced in the hospital or clinics. And unlike other countries, we did not really have a large population who experienced in the religious places, maybe because in mainland China, not many people that have religious beliefs, or they don't go to religion places usually often. So those are the characteristics of the SOGICE. And then here are the mental health outcomes of this population. We can see that more than 20 of them reported depressive symptoms, self-injury behaviors, and PTSD symptoms, and nearly half them have ever had suicidal ideation or attempts. And we access the associations between the SOGICE experience and the mental health outcomes. We can see that they are positively correlated with depressive symptoms, non-suicidal self-injury behaviors, and PTSD symptoms. But the association between suicidal ideation or attempt was not associated with SOGICE. And here, last is the discussion and implications. So the SOGICE experience among Chinese LGBTQ people and also living with HIV individuals display distinct characteristics. We talk about the location, the duration, the type of engagement that they have, and they are not, so there are some unique characteristics. And also reinforcing the growing body of evidence highlight the associations between SOGICE and mental health problems. And also we found that a lot of them experienced the SOGICE in counseling settings, in hospitals and clinics. So these we couldn't help but thinking that they might have a mistrust for the healthcare providers, especially when these are provided by professional psychologists. And so that may further reduce their motivation to seek for mental health problems. And so the findings make us to think that the future, the mental health services for this population, they should prioritize the people who have HIV and also who experience the SOGICE, and providing their trauma-informed care, providing stigma reduction interventions, and also gender-affirming services to promote their healing and resilience, and also to think about how to rebuild the trust between professional psychologists and people who had experience of the SOGICE. And additional future research is needed to understand the long-term impact of SOGICE on the treatment outcomes and the risky behaviors of people living with HIV and AIDS, and also inform the future strategy for prevention and support. And here, acknowledgement to all the investigators and the participants in this cohort study, and also thanks to all the team members of this study. That's all my presentation. Thank you.